Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Dr. Murshid Latif is an obstetrician gynecologist on the Mon General Hospital medical staff and has relocated his practice. We're going to start off talking about that this morning. Good morning. Welcome to the program.
Good morning.
All right. Now, your new practice is called what?
It's called Morgantown Obstetrics and Gynecology, and it's located beside the hospital on Pineview Drive, 1191 Suite H on Pineview Drive.
Well, I would ask you what you do there, but I think it's all in the name, Obstetrics and Gynecology. Is there a particular reason why you moved or went to this new location?
First, the location is really close to the hospital, which is very convenient. And also, I'll be by myself, which is really, I like that idea of having a special relationship with the patient and one-on-one relationship with the patients. So that's really good for the patients to know who's her physician, what's the plans with that physician, instead of really going through different physicians. So that idea really, I like it, and I wanted to go on my own.
Yeah, so why did you want to focus on women's health?
It's really, from the beginning, I always liked the idea of women's health, including really pregnancy and delivery. It's a really wonderful experience. You share that experience with the parents and with the family. So it's a enjoyable experience that I really, for sure, like to be part of.
And also a part of your education is research
Yes.
in obstetrics and gynecology. What types of things or areas did you research?
Different researches. One research, it was about preterm labor and preterm deliveries, and also about ovarian diseases, including ovarian cancer. So that was part of the research that I did before.
On previous programs of Health Talk here on WAJR, sponsored by Mon General, we have talked about the upgraded family birth center at Mon General. And where are we with that so far?
They're in the process of this process, and they're going well. I mean, maybe you know by now, we have 8 labor and delivery rooms in the unit, and we're expanding to 16 labors and delivery units. Each rooms, each room is going to be for both, labor and delivery, and even after the delivery, the patient stays in that room for recovery and postpartum checkup. So that was good expansion for us, especially knowing that the number of deliveries recently, especially within the last year or so, it really more than doubled at Mon General.
All right, let's get into some topics with women's health today with Dr. Murshid Latif, and open up the phone lines at 304-296-0041. If you have any questions, you know how the show works. All the information we're providing you today, absolutely free from a doctor who is on staff at Mon General Hospital. So let's talk about preterm labor. So what is the date, or what is the term preterm labor? What exactly does that mean? Is that you do that into weeks of gestation?
Yes, I mean, preterm labor, it's very serious complication or a problem with pregnancy, because it will end up with delivering a baby which is premature baby, with all the complication of premature babies. This is why it is a very serious and important topic to talk about during pregnancy. But the definition is if there is any labor or delivery before 37 weeks of gestation. Any delivery before 37 will be considered as preterm labor or preterm delivery.
How many weeks is a full-term gestation?
The full-term gestation, it's 40 weeks. Above 30, after 37 weeks, it's considered term pregnancy. Any delivery or even labor before 37 weeks, it's considered as preterm labor.
Well, we like to say that the baby can't wait to come into the world, and so he's knocking on the door, so to speak, quickly wants to come out. But there's got to be a medical reason for preterm labor.
Exactly. I mean, for sure, I mean, we'd like the pregnancy to go full term. That's good for the baby and for the mother. But unfortunately, that there is sometimes that preterm labor happens, and we really need to deal with that when it happens. So there is different causes for the preterm labor. A lot of times it's unknown, it just happens, but we are not sure exactly what's causing it. But for sure there is other predisposing factors or factors that can cause preterm labor, and those are the ones that we really need to work on so that to prevent that patient to go into preterm labor.
Most of us in this room probably have not had contractions like women have.
Yes.
But preterm labor, mom-to-be starts having contractions.
That's the main symptoms of preterm labor is the mom start noticing that she's having contractions. With pregnancy, every pregnant woman will have some contractions, especially later in pregnancy. But that's normal. We're talking about real regular strong contractions that they come almost every 5 to 10 minutes and they don't go away, they get stronger. Those are the contractions we're really concerned about, and we're really worried about preterm labor, especially if there is other symptoms with those contractions. The mother, she might start noticing that there is a lot of pelvic or lower abdominal pressure. She might notice some bloody discharge. And if she notices bloody discharge, this is a serious thing that for sure she really needs to let her physician know. Sometimes she might notice leaking fluid. So if there is these contractions, this is for sure a sign of preterm labor. If it's associated with something like what we said, bloody discharge or leaking fluid, for sure that's even more serious, that she really need to get to the hospital or contact her physician.
Yeah. So how long does a contraction last? I mean, does it start briefly and then expand?
It varies, but a lot of them, they start really not frequent contraction, then they start becoming more and more frequent. If she's having more than 6 to 10 contractions in an hour, then she really needs to be concerned.
All right. And so we're talking about causes right now of preterm labor. Most causes are unknown, but what if in our previous births we had preterm labor? Can we expect that this child will also be delivered preterm?
That's one of the most really causes or things that for us to be concerned about preterm labor. If that mother, she had previous preterm delivery, then she is having much more risk or chance for going into preterm labor. So that one, we really need to take care more of this patient than somebody who never had preterm labor in the past. And there is other conditions also that we're concerned. If the mother has that condition, we're really concerned about preterm labor. One of them is like if the mother, she's having twins or triplets or multiple gestations, because those patients for sure, they have higher chance of going into preterm labor. Other things also about preterm labor that might also predispose to preterm labor, if the mother is having high blood pressure or if she's having diabetes. So also those two conditions increase the chance that this pregnant mother might go into preterm labor. There is also other conditions. If the mother is too young, like she's less than 17 years of age, or she's really also older, more than 35 years of age, also those have higher chance of preterm labor. Other conditions which is very preventable and very important, like smoking, alcohol, if they're drinking during pregnancy, or they're using drugs. Those things for sure predispose to preterm labor.
Oh, very bad for the baby too.
That's for sure.
I mean, hopefully we know, or most moms know, not to smoke, drink, or use drugs while carrying a baby.
Yes, I mean, it causes a lot of problem for the baby to start with, and on top of that, they're really exposing themselves for preterm labor on top of all the other risk of these things. Also, other risk that sometimes also with for preterm labor, if there is any trauma, like if somebody's having car accident or she was hit on the abdomen, for sure to alert her physician, because that can cause also preterm labor. Weight of the patient, they found some relationship also with the preterm labor, that if they're way overweight or underweight, also they're having higher chance of preterm labor.
So you need to be a happy mom in shape with no vices to avoid preterm labor, or perhaps if you didn't have preterm labor with your previous children, you're okay in that regard.
If you need to be healthy, you need to really be go for your prenatal visits, be sure your blood pressure is okay, your sugar is okay, and to avoid other risk of preterm labor for sure.
Yeah, because as the doctor, you're going to know if our blood pressure is high and if we're diabetic, and so you probably have a regimen for mom to follow in those regards. Does blood pressure medicine, is that good or bad when you're carrying a baby?
I mean, there is the blood pressure, high blood pressure for sure. It's a risk for the pregnancy in general, and on top of that, it might expose to preterm labor. If the patient if she already have high blood pressure even before pregnancy and she is on blood pressure medication, for sure we continue the blood pressure medications. Some blood pressure medications, they are contraindicated or can't be used during pregnancy, so sometimes we switch to other medication for the blood pressure that's safe for the pregnancy. For diabetes, the same thing. I mean, if she's diabetic before, we really try to control the blood sugar from the beginning of the pregnancy, so the risk of diabetes on pregnancy will be less, and also the chance for preterm labor would be less.
And finally, in causes, if you've had previous surgery on your cervix.
That's also another thing, which is especially recently, there is what we call LEAP procedure, which is if the cervix has precancerous cells, sometimes we cut small piece of the cervix or part of the cervix. And if we do that procedure, that makes the cervix is a little bit weak, and for sure that predisposes for preterm labor. So anybody when they come for their prenatal visits, we always ask if they have any surgery, especially on the cervix, to see if they have higher chance for preterm labor.
Well, you've said that most causes are unknown, but it sounds like we've gone through a lot of causes.
For sure, there is a lot of causes and predisposing factors for preterm labor. Some of it's unavoidable, but a lot of it, for sure, it can be avoided and can be treated.
Dr. Murshid Latif is our guest this morning. He received his medical degree from the Jordan University School of Medicine in Amman, Jordan, did his residency in Washington, D.C. He was chief resident and Lincoln Medical and Mental Center, New York Medical College in Bronx. He did a fellowship in maternal fetal medicine at Indiana University School of Medicine, Department of Obstetrics and Gynecology, and it just sounds to me like you really loved going to school, didn't you?
Well, I mean,
you're still going to school? Are you still getting degrees and credits?
Not degrees anymore, but for sure working.
All right. We're going to take a break. You're listening to Health Talk, brought to you by Mon General and WAJR.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Dr. Murshid Latif is a gynecologist on staff at Mon General Hospital and also has relocated his practice called Morgantown Obstetrics and Gynecology at 1191-H Pineview Drive, right below Mon General Hospital. And if you want to write down the telephone number, you can get more information without being on the air. Not everybody wants to be on the air, that's for sure. 304-212-5620. Many people don't want to be on the air to talk about labor or preterm labor, which is our topic today. Now, if a baby is born premature, they call them preemies, does the baby once delivered immediately go to an intensive care unit or an incubator? And does the mom have a chance to hold that baby at all?
It depends on the gestational age. I mean, for sure, there is very premature babies because babies can be born premature between 24 to 34 weeks. And the later the gestational age, for sure, the better chance for the baby to be better and need less intervention. So some babies, if they're born way premature, for sure, sometimes they need special attention before the baby is able to.
Yeah. What are the latest functions to develop, I guess, is if a baby is born premature, is there certain parts of the baby that have not fully developed?
For sure. I mean, all the organs, they mature as the gestational age goes on. One of the most important really organs that we're worried about, especially with babies, is the lungs, because the lungs, they really need to be mature enough when the baby is born, that the baby is able to breathe, get enough oxygen. So the lungs, one of the late organs to completely develop and function, and this is why we prefer for sure for the patient to deliver later in gestational age and not to have preterm labor. But still, all the organs, they're important, because if the baby is born premature, kidneys, liver, brain, still they might not function the way they're supposed to at that age.
Do premature babies oftentimes have learning disabilities or learning problems?
That's the main thing about preterm labor, because preterm labor, I mean, 75 to 80% of the perinatal mortality, or the babies when they're born, they die, is because of prematurity. So prematurity is one of the major risks for babies for survival, but also in the same time, if they're especially born premature, they might have other problems, which is like learning disability, physical disabilities. So for sure that will affect them for the rest of their lives.
When we come back in our final segment after the break, diagnosis. Can you be diagnosed ahead of time that you might be susceptible to preterm labor? We'll talk with Dr. Latif about that coming up in just a moment here on Health Talk, brought to you by Mon General on WAJR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Back with Dr. Murshid Latif this morning on Health Talk on WAJR. If we have some contractions when we come see you, that doesn't automatically mean that we're going to deliver then, right? I mean, can we go back home?
For sure, it doesn't mean that the patient will go into preterm labor, for sure, and we do every step possible for sure to prevent that from happening. And this is why mainly if somebody comes in with contraction, the main thing first is rest and give them a lot of fluids. And a lot of them, contraction, they go away and everything goes well. If that's not helping, then for sure we start now, we're talking about using some medication to stop these contraction and prevent preterm labor. And one of the medications is steroids. We give injections of steroids. And the injection of steroids mainly not to prevent the preterm labor itself, but it will increase or speed the lung maturity. So if the baby is born, it will have better chance for breathing and less problems with lungs. Other medications, for sure, we can use them also to stop contractions, and there is different medications that we can use, including magnesium sulfate or ritodrine. And those medications, it just cause the muscles to relax and prevent preterm labor. So for sure, there is things that we can do to prevent the patient going into preterm labor.
First thing you can do is get yourself an OBGYN. You can also eat healthy, gain weight wisely, avoid smoking, drinking, drug abuse, limit certain physical activities, and of course, always consult with your physician. Thank you so much for the information this morning.
Sure.
And again, Dr. Murshid Latif, our guest on WAJR's Health Talk program, which is brought to you by Mon General Hospital, Thursday mornings at 8:35 here on WAJR.